Hi, this is Bob Vineyard with the Georgia Medicare Minute. Let's talk about liking your Medicare plan. It's time to ask the expert a question. All right, I have a client. She's been a client for a number of years, and she's now 75. She's had an F plan ever since she went on Medicare, and her premium is going up and up. And it's going to be going up again here in another month or so to $181. She's a widow. Her husband died a couple of years ago, and money's been tight. So we're doing things we can to help her save some money. One of the things that I did was suggested a change in her drug plan. The plan she'd had for a number of years, and she just never wanted to change it. The plan she'd had for another number of years was going up to about $70 a month. Well, she didn't need a $70 a month drug plan. So looking at the medications she's taking, I said, there's a plan out there for 2019 you can get for $14.50 a month. And that's going to save you a lot of money, and your drugs are not going to cost any more. The copays are almost identical. And in some cases, the copay is actually going down. So that was one change. That was a fairly easy change to make. The bigger challenge was her Medicare supplement plan. Now, keep in mind, you can change your Medicare supplement plan at any time. There's nothing magic about open enrollment when it comes to Medigap plans. And remember, Medigap and Medicare supplement are interchangeable terms, just like Kleenex and tissue. So when I talk about Medigap and I talk about Medicare supplement, I'm really talking about the same thing. But the Medigap plans are a little more challenging. You can change them at any time. There's nothing magic about open enrollment because you're going to have to go through underwriting. And that's why you can change them in January, February, March, June. You can change them anytime, not just during open enrollment time. And fortunately for this lady, she is in good health. She only takes, I think, one blood pressure medication, one cholesterol medication, which is pretty much typical for most of my clients. So anyway, we looked at it. As I said, she's got an F plan, and it served her well for a number of years. She likes it because she doesn't have to pay anything out of pocket when she goes to the doctor, and that works for her. But the premium is going up in another month or so to $181, and that's a bit of a stretch. And even with the savings that we're looking at for the drug plan, it would still be nice to have a little bit more wiggle room, if you will, in your budget so that she could save some more money. Well, all right, here's what we looked at. The first thing, and I'm going to look at my notes here. The first thing she can do is she can change her F plan for another carrier. That'll save her about $27 a month, a little over $300 a year. And she agreed, okay, that's nice. And then I said, well, why don't we look at a G plan? It's almost identical to the F plan. The only difference is you would have to come out of pocket for your Medicare Part B deductible, which next year is $185. But after that, after you have paid that, and it may take you 2, 3, 4, 5, 6 visits to the doctor before you ever satisfy that, so you will have to come out of pocket a little bit there. But once you do that, you have an F plan for the rest of the year. You'd pay nothing for hospital. You'd pay nothing further for any kind of outpatient treatment. And you're going to save $56 a month over your F plan renewal. Well, now we're talking about over $600 a year savings versus the $300 or so, and keeping an F plan and but just simply changing carriers. Well, that got her attention as well. So she said, well, let me think about it, and I'll get back to you. I said, that's fine. You don't really, there's no deadline on this. You can change any time, but we do need to go ahead and change your drug plan because that's coming up here in about another 10 days as to the deadline for drug plans. So she talked it over, and a couple of days later she called me and she said, well, I've talked to my friends and they said I need to keep my F plan because it's going away in 2020 and I need to keep that as long as I possibly can. So I think I'm going to keep my F plan, and but I still want to save the money. And I said, well, that's fine, but let's look at this for just a minute, and it doesn't matter to me. I want you to be happy. And I'm not trying to sell her on something that she doesn't like or doesn't want. I mean, that's just not the way I work. All right, so let's look at your F plan. As I said, you can currently save about $27 a month. But let's look and see what's going to happen over the next couple of years. Well, I don't know where her renewal rates are going, but I can tell you that your F plan rates for this the same carrier at age 76, and she's 75 now, would be $160. Well, that's about $5 or $6 a month more than she would be paying with if she changed plans. Same carrier, but changed plans. At 77, it's $166, and then at age 80, it's $188. So basically what she's doing, if she keeps her F plan but changes to a different carrier, in less than 5 years, she's going to be up where she is right now. And so she gets 5 years worth of savings, and that's fine if that's what she wants to do. But let's look at the G plans. The G plan, changing to a G plan right now, will save her $56 a month over her $181 renewal. So what happens with G rates? Well, the current rates for age 76 on a plan G are $127. At age 77, it's $129, and at age 80, it's $139. So she could run this thing out for another 5 years and still not even come close to what her F plan renewal is. And so she's thinking about that. She still doesn't want to give up her F plan, and that's fine. Again, it's her plan, it's her money. She needs to do what she feels comfortable with. But this just points out that if you have an F plan, and you can keep it past 2020, the only thing is that new people going on Medicare as of January 2020 will no longer be able to buy an F plan. So the F plan is going away, but that's only for new entrants. It's only for new entrants. It's not for anybody who currently has a plan. However, if you do have an F plan and they're not going to be writing any more new plans, then you're part of a group that's getting older and sicker, and so your rates are going to go up most likely at a higher clip than they would be if they were still actively writing business. So this is Bob Vineyard with the Georgia Medicare Minute, giving you my expert opinion on options and so forth. You take care. Have a great day.